Hi, hello everyone. Today we will discuss bleeding time and clotting time. The aim is to determine the bleeding time of a subject, and the requirements are sterile lancet, cotton, rectified spirit, filter paper, stopwatch. Procedure: Duke's method. Sterilize the finger tube using rectified spirit and allow to dry. Make a sufficiently deep prick using a sterile lancet so that the blade comes out freely without squeezing. Note the time. Start the stopwatch when bleeding starts. Mop the blood by touching the fingertip with a filter paper. This is repeated every 15 seconds, each time using a fresh portion of the filter paper till bleeding stops. Note the time. Stop the stopwatch. It is seen that the blood stains on the filter paper get smaller to disappear finally when bleeding stops. Bleeding time is the interval between the moment when bleeding starts and the moment when bleeding stops. Normal bleeding time by Duke's method is 4 minutes. Bleeding time is prolonged in purpuras but normal in coagulation disorders like hemophilia. Purpuras can be due to platelet defect, that is thrombocytopenic purpura. Primary or idiopathic thrombocytopenic purpura. Secondary thrombocytopenic purpura. Vascular defects, senile purpura. Hinoch-Schönlein purpura. Platelets are important in preventing small vessel bleeding by causing vasoconstriction and platelet plug formation. LVUIS method. Apply a sphygmomanometer cuff to the arm, raise the cuff pressure and maintain at 40 mm of mercury. Under sterile conditions, make a deep prick on the forearm just below the elbow. Bleeding time is noted like that in Duke method. Normal value is 2 to 7 minutes for LVUIS method. Clotting time. The aim is to determine the clotting time of a subject, and the requirements are fine capillary glass tubes of about 10 mm in length, cotton, rectified spirit, lancet and stopwatch. Procedure: capillary tube method or Wright's method. Under sterile precautions, make a sufficiently deep prick in the fingertip. Note the time when bleeding starts. Start the stopwatch. Touch the blood drop at the fingertip using one end of the capillary tube tilted downwards. The tube gets easily filled by capillary action. After about 2 minutes, start snapping off the small length of a tube at intervals of 15 seconds, each time noting whether the fibrine thread is formed between the snapped ends. Note the time. Stop the stopwatch when the fibrine thread is first seen. Clotting time is the interval between the moment when bleeding starts and the moment when the fibrine thread is first seen. The normal value is 3 to 10 minutes. Bleeding time and clotting time are not the same. Bleeding time depends on the integrity of platelets and vessel walls, whereas clotting time depends on the availability of coagulation factors. In coagulation disorders like hemophilia, clotting time is prolonged, but bleeding time remains normal. Clotting time is also prolonged in conditions like vitamin K deficiency, liver disease, disseminated intravascular coagulation, overdosage of anticoagulants, modified Lee and White method. Under aseptic precautions, vein puncture is done and 1 ml of blood is collected in each 3 small test tubes. Note the time when blood is taken. Keep the test tubes in a water bath maintained at 37 degrees centigrade. Tilt the tubes every 30 seconds and see whether the blood is flowing. Repeat this till the tube can be inverted without the blood flowing out. Note the time. Average value of the results in the 3 test tubes gives the clotting time. Normal value is 2 to 7 minutes.